Hey everyone, Dr. B here. Thanks for tuning in. I wanted to talk to you guys today about what does sobriety look like for you, which is a really individualized question that everyone needs to answer for themselves and really have a good understanding as they're starting this process. Of course, all of us want to believe that we can be, more moderate users with whatever alcohol or drug of our choice is, but that's not always the case. But the topic today I wanted to look at really also involves, what do other drug or alcohol usage beyond your drug of choice, how does that fit into the picture? Or also the concept of addiction substitution, which is really just substituting one addiction for another. So as you're starting this process, you really want to get clear about what that looks like for you. As a treatment professional working in some of the best treatment centers around the world, it's always kind of made me laugh how it's okay for people to, not do some drugs, but do other very harmful, destructive, addictive drugs while they're in treatment, actually. And what I mean by that is smoking, right? If you go to any 12-step meeting or any treatment center, I can't tell you how many people have started smoking cigarettes while in rehab. And so why is it okay to stop doing one drug, but to start doing a completely addictive and harmful, destructive drug, at the same time? It's always made me laugh or wonder, kind of the hypocrisy around that. The thinking goes that it's too hard to stop all things at once, but I think that's really just an excuse to let people continue doing, kind of drugs and not, kind of helping them achieve the healthiest state that they can achieve. But again, it's all an individualized choice, what you want for yourself and what's okay for you. But I really wanted to make today's session about creating awareness, how if you're not careful, you can easily substitute one addiction for another. But before we talk about that, let's talk about how here in the US we have what's called an abstinence-based model when it comes to recovery, which means that in the US, practically all treatment centers, except for very few, look at you have to give up using drugs and alcohol completely, whatever your drug or alcohol of choice is. And that you can never use it ever again, and that if you do, that you've relapsed and that you're still stuck or sick or ill, whatever label people want to put on you. I think that's a little bit destructive and stigmatizing and not always the best approach, labeling people with a sickness or an illness that's incurable. I think that if we get to the underlying cause of the addictive behaviors, and kind of treat whatever trauma, depression, anxiety, or other mental health related issues that are there, oftentimes these addictive, compulsive behaviors will lessen or remit or become more manageable or not really that destructive in their nature. And so again, you really need to figure out what that's going to look like for you. I've always said, if a drug or alcohol isn't a problem for you, then it shouldn't be a problem giving it up for, let's say, 90 days or 6 months, right? Just stopping it completely, because that'll give you some insight, even for things like coffee, right? Try going 30, 60, 90 days without drinking coffee, or, smoking cigarettes for those of you who smoke. But, when you start to kind of stop doing your compulsive behaviors, you start to really understand how much of a hold they have on you. So, if you're on the track to getting healthy and well, my advice is to try and stop all the, harmful substances. Smoking is one of the most harmful ones, so why not try to give up smoking as you're also giving up alcohol or drugs. But let's talk about addiction substitution now. So what that means is oftentimes what we find is people who go through treatment is once they stop one addictive drug or alcohol, they usually substitute it for another substance or another behavior, right? So what that means is, let's say a person's stopping drinking or using drugs, let's say cocaine, right? So they stop drinking or using cocaine, but then they start, using marijuana or, painkillers or benzos, or engage in compulsive behaviors like gambling or sex or shopping or even work, right? And so really we're just stopping one self-destructive behavior and substituting it for another without really looking at, again, what the the function of that behavior or addiction is serving, right? And what we find, and I'll get into this in another later discussion, is that oftentimes the addiction, the addictive behavior or substance is really creating or filling a void for feelings of helplessness or feeling overwhelmed emotionally, or feeling powerless. And so, that drug, alcohol, or behavior in the moment serves as an empowering function to kind of avoid or take one's mind or distract oneself from feeling powerless or helpless or overwhelmed emotionally, and helps them feel okay in that moment. But of course, when they're done using or engaging in that behavior, the old overwhelming feelings come rushing back, and the cycle just continues. But for you, as you go through this process, you really just need to, again, kind of figure out what health looks like for you. Again, all of us want to believe that we can be moderate users. The statistics tell us that that's often not the case. If you've been really heavily using drugs or alcohol for a long time, the likelihood of being able to use it moderately is a very small percent. About 5 to 10% of people are able to do that. But, if you address the underlying issues, it's not, impossible. It definitely has been done. I know a lot of people who have, kind of gone back to healthy, moderate uses of alcohol and drugs after addressing those issues. And the thing you don't really hear much about is that many treatment centers outside the United States, especially in Europe, use what's called a harm reduction model, which means looking at reducing one's use from destructive levels to more moderate, manageable levels, again, while addressing the underlying issues of addiction. So just inform yourself, do a lot of research, but also be really honest with yourself. Why is it that you're wanting to continue using these alcohol and drugs? Especially if they are causing health risks, such as alcohol. Let's be honest, alcohol is one of the most destructive drugs out there. Just because it's legal and socially acceptable, it's still very harmful to our bodies. Same with smoking. So, have an honest look in the mirror and really check in with yourself. Is if you do want to try to become a moderate user, why is it? What function is that still serving? And really prove to yourself that you can do it. Be sober for at least 3 to 6 months before you start to do it moderately. All right, thanks for tuning in. Take care of yourselves and others. Peace and love.